We've already talked about how you can improve your bone health preoperatively, and that should, I think, be done on all people that are having elective surgery. It's very important. Then you get to surgery, and you're going to be taught, hopefully you'll be spoken to by the surgeon about instrumentation and what the procedure is going to be and what kind of bone grafting they're going to be doing. We really have three choices for bone graft. We have your own bone, which we take from your pelvis or front or back, and of course there's a lot of myth about how much pain that causes, and it is variable between people and how you do the technique, of course. And you have a limited supply, and you remember we've already talked about the fact that as you get older your bone gets poorer, so the quality of the bone graft and the quantity, the amount you can get to do a fusion, particularly on a longer fusion, is very limited. So you reach the point that you have to supplement it, and most people would recommend something called allograft, which is cadaver bone, that's been processed in some fashion. There's a million variants of that available. That's all produced by various commercial companies, but it all still comes from the tissue bank. And some of it works better than others, and there's various formulations, but all the claims that are made are probably sometimes not so accurate. It can only be used to extend your own bone. In other words, you mix it with your autograft from yourself because it doesn't have any living cells in it to really promote a fusion. The third option is what we call bone morphogenic protein, which is approved for certain specific indications, and it's the actual protein within your bone that is part of the cascade that when you break your bone causes new bone to form by inducing the formation of bone cells that heal the bone and then allow it to heal. Well, when we do a fusion, that's pretty much breaking your bone in a way. So the BMP actually will kick on the healing cascade and will actually direct the cells to differentiate into bone cells and actually cause a fusion. And that's the third option that's been commercially available now for almost 2 decades. So those are your kind of three options that you can be offered in various combinations. And what is used is best spoken to specifically with your physician and the availability and the cost and the specific kind of fusion and length of fusion you're going to need. You can discuss what bone graft options are available for you with your doctor.